How would you treat anxiety, whether by itself or in tandem? Could you give us some examples of some possible treatments?
Absolutely. So Banyan Health in particular, we ascribe to model fidelity. We use evidence-based practices. The two that we use in therapy are solution focus and cognitive behavioral therapies. So our therapists will use those for the depression, for the anxiety, in combination with, again, as needed, psychiatry. So our therapists know and our psychiatry department knows we refer in-house, that's part of the integration, that the patient doesn't belong to one, it's the entire team. It's who best can provide services. So in an instance, there may be the need for medication for either of those. However, we always recommend that psychotherapy, that behavioral therapies are a first-line intervention and in tandem with any medication for a child.
Gotcha. I'm glad you mentioned that because immediately in my mind I thought, where does medication play into this? Because as a lot of us know, it's often prescribed first, and then we treat later. But this is wonderful that you're treating on a counseling basis first. Can you explain to us a little bit about cognitive behavioral therapy? How does that work? What is it?
Absolutely. So the idea is that our thoughts are tied to our behaviors. So it could be a child that we have faulty thinking. The way we see something, our perception of something might not be true. Our anxiety can exacerbate that. We use the example with children as a snowflake. So you have one worry, one thought that starts as a snowflake, but then as our mind continues to work up about all of the things that could happen and where that will go next, that snowflake has turned into a snowball and an avalanche that is all-consuming. So the idea of cognitive behavioral therapy is to identify the different faulty thinkings and such and change the way we're looking at things to then affect our behaviors and the consequences and reinforcements and such that follow.